so I'm looking on the computer at the orders and I see that I have an order for a blood draw for whatever reason, usually for some kind of lab. So I'm going to gather my supplies. I need 2 flush syringes, gloves, however many test tubes that, the test calls for. I've been practicing with 2. I need my access device or vacutainer and alcohol wipes. I'm going to put this in the order that I'm going to use them. And then I'm going to flush, aspirate, waste, draw my blood, flush, wait no, access device. Where did the second tube go? It just disappeared. Okay, I found it. It was under the flush syringe. Magic. Okay. Now I'm ready to go. I don't think I need... Yeah, there's not really anything else I need other than to just gather my supplies. Okay, so I make my way over to the patient's room. Knock, knock, knock. I come in. Hello, I'm Bree. I'll be your student nurse today. I am here because your doctor has ordered some blood labs, or some labs that require me to draw some blood from your CVAD. So I'm going to do that real quick. I provide privacy. I'm going to do my 2 identifiers. Can you give me your name and your date of birth?
September 49.
Do you have any allergies?
No.
Perfect, thank you. I scan my patient, check and make sure I have the right patient. Hand hygiene. For a CVAD, we have to do a pre and a post assessment. The pre-assessment calls for checking the dressing site, just like with anything else. We're looking for signs of infection or inflammation, so any sort of swelling, redness at the area. Drainage sometimes can be a sign of infection as well. But one very important thing that we want to make sure we check is the placement of the tube, because sometimes when we're messing with it, it can move, and then that is like a whole other thing that we have to deal with when that happens. So I'm going to do all that. I'm going to do my pre-assessment. I'm going to check the placement of the tube. It is at, I'm going to say, in the middle of the 2 markers. So I'm going to keep that in mind. And I think I'm ready to go. Okay, so I'm going to set up now. Hand hygiene, and then put my gloves on. Grab an alcohol wipe. Usually they have positive pressure caps on, and caps on top of those positive pressure caps. The caps that are on those pressure caps are one-time use only. So I would also have a extra cap with me. I'm just going to have to vocalize that because those things are apparently short stock or whatever the heck. So, oh, I also need, I can't forget, if I have this skill, I also have to grab a specimen bag, a biohazard bag, and labels for my tubes. I gotta remember that. So yeah, I've also got that. And an extra cap. So I remove the orange cap, throw that away, and I'm gonna wipe this with an alcohol swab for 30 seconds. And then let it air dry. Throw that away. I have to be very careful because this goes right to the heart. I have to be as sterile as possible. The only thing that needs to remain sterile is the opening of the cap or whatever the heck. So I don't want to hold it like this because then it's touching my palm and that's breaking sterility, potentially leading to an infection. I'm going to move this up a little bit. Okay. That wasn't much. Oh, with blood draw, I also want to make sure that I'm using the distal tube for blood draws. So I check which one is the distal tube. Clean the cap. I let it air dry. I'm going to grab this, my first flush. This is the most complicated part.
I don't know if it's not to squeeze the tube so it doesn't block.
Well, right now it's closed anyways.
I mean, like, when you unlock it, I'm trying not to squeeze the tip here.
Why is it so hard? Am
You
I turning
turning
it the wrong way? I'm turning it both ways and it's not. Alright, hold on. Pretend I didn't drop this.
Don't do this.
Alright, that never happened. So, I took the cap off. I'm checking there's no air bubbles by squirting some or wasting some. And it goes. Open. For CVADs, we are going to always flush 10 mLs of saline because the line is very long.
Pretend it's long.
And for the first flush, I can do that for about 2 to 3 minutes. Before I do the whole 10 though, I'm going to push 1 to 2 mLs just to check for patency. It's patent. Now I want to aspirate to check that it's in the right place. I am positive for blood return. So now I'm going to start flushing 2 to 3 ml. Yes. No, 10 mLs in total over 2 to 3 minutes. Pretend I did that. I don't want to waste all the water. Once I have flushed, wait, before I take this off, once I have flushed, I now have to waste 10 mLs of blood. So I'm going to pull back on my plunger and make sure I get 10 mLs of blood to waste. Pretend I got 10 mLs of blood and not a bunch of air. I always struggle putting these back on when I'm wearing gloves. Maybe it's better if I turn it upside down like this and then there we go. There we go. Okay, that's the trick. That's what I need to do. Alright, so now I'm going to take this off. And this goes in the biohazard bag because it's got blood in it. Now, I'm going to take my central venous access device.
CVAD.
I mean, not just the central venous access device is what I'm drawing blood from. This is just a venous access device or a vacutainer. So I'm going to plug that up. I can go ahead and unlock this because the vacutainer is gonna keep it from like leaking or whatever. I'm going to push. Pretend I push this through and I get blood. That's the blood.
Hopefully it doesn't make that noise.
I'm gonna slowly shake this to make sure it doesn't coagulate. Set that aside in the specimen bag. Same thing. Push. That's the blood filling up. I'm gonna gently shake to prevent coagulation in the specimen bag. Now I need to close this back because I've gotten my blood samples. This goes in the biohazard bag. I'm gonna grab my final flush. check for air. There's no air. On it goes. Open it up. Same thing, 10 mLs over 2 to 3 minutes. But this time I don't need to aspirate blood or waste any blood because I've already done all that. So once I disconnect this syringe, it's going to be empty. So pretend this is empty. I'm going to take this and clamp it back. Now with the central, especially the ones that we use in the lab to practice with or whatever, they have positive pressure caps. So technically we don't need to be doing all this clamping and unclamping, but I like to practice with it just in case, because not every place is going to have those caps.
Not every place is fancy.
Okay, now I'm going to throw this away. I'm going to grab my new cap and put it on. Well, I guess before I put the new cap on, I should probably wipe it with the alcohol wipe. Then I'll put my new cap on. Does this actually fit on here? No, it doesn't. So pretend I put a cap on. Oh, is that it?
I don't think so.
Oh no, I think this is what goes on that pressure cap. I don't want to lose it. Thank you. Okay, so I've drawn my blood. I'm going to put my labels on my tubes in the specimen bag, zip it up. I'm going to do my post-assessment. I'm checking for the same things. I'm checking, well, actually no, I'm not checking for the same thing. The only thing that I'm like rechecking or whatever is the placement of the tube. So I see that the CVAD hasn't moved. So I'm good on that note. I'm going to ask the patient how they're feeling, making sure that they tolerated the procedure well, and then I'll be sure to document that they tolerated it well. I also need to document what tube I drew blood from, which in this case would be the distal tubule. So I'm done with that. Okay, I will be back in 30 minutes. If you need anything before then, you have your call light next to you on your right side. Otherwise, I will see you then. Lower the head of the bed, hand hygiene, and I'm out of there.
Very nice, Bree. If I am your clinical instructor, then I will not give you 100%, but I'll give you 99.9%. You did very well. Very well. Very well, Bree. Very, very well.
So that's blood draw.
Amen.
Okay.
Very good.
Okay.
Very good. So it worked, huh? The bottle.
Yeah.
It really worked. Huh? Very good. Very nice, Bree. You're so well.
I forgot that there was water in that. Ah, dang it. I can't like squirt the air because I want to squirt. It should be fine if I do this, right? Yeah.
You are so well informed. It's
Okay,
really,
no, I'm scared.
it's really worth your studying, huh?
Okay.
Very nice.
You have more?
Yes, medication administration and CVAD.
Yeah, my parents can do their thing now, right?
If they want, yeah.
Oh,
That was how we had it,
Yeah.
right?
pa video lang ka, huh? Very nice.